Hi, I'm Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm pleased tonight to be joined by the folks from Metrohealth in Cleveland. Dr. Alexander, I turn things over to you.
Thank you. So this is the fourth of our presentations. I don't know if any of the students or participants were able to log in to some of the other presentations, but we're kind of showcasing a lot of what we have to offer for community medicine and managing different populations in different settings. So for tonight, we're going to talk about LGBTQ health, which we refer to as our Pride Clinic and our Pride curriculum. And so for this evening, the moderator for the discussion is going to be Dr. Allison Myers, who is actually new to our staff, our faculty, having just joined us recently. If you logged in, you heard that she and her wife are in an apartment, which is an adjustment from being in a house. And so she's actually going to lead the discussion. Dr. Myers' other role in our department is as the Director of Maternal and Newborn Services. So she really has lots of different hats that she wears. And then we also have Kate Kelly with us, who's one of our stellar interns, and Kate worked in our Pride Clinic as a student. So I will turn it over to you, Dr. Myers, to lead us from here.
Great, thank you. Thank you so much, Dr. Bauer and Dr. Alexander. So I'm just going to go through a few slides just to kind of give everyone an overview of our Pride Clinic. As Dr. Alexander mentioned, I'm one of the faculty members here and one of the faculty who works within the Pride program. So let me just pull up the slides. Allow Zoom to share your screen is what I'm being told.
Huh, I'm guessing that's a yes. There usually is like a little green button that says share.
I'm trying to do this now. Let's see if I can do it again. I see the share screen button. That's what I pressed. And let me try this. Let me try doing it this way.
Yep. Oh, there you go. You got it. Did
that work? Okay, great.
Yep.
Okay. So, as a newish faculty member here, if I have any of these details incorrect, please, by all means, correct me, Dr. Alexander or Kate. So, our Pride program started over a decade ago. It was started by family physician Dr. Doug Van Auken, who actually just retired from our department earlier this month. At the time that it started, it was just 2 docs and 1 social worker who volunteered at the time, and it was just 1 evening session per week. The current state of the program is that it's composed of 5 family medicine physicians within our department. We also have 2 med-peds physicians and 1 pediatric endocrinologist who heads the Kids Pride program. And so most of the kids are seen within Kids Pride, and we sort of take over from age 18 on up. We have 1 psychologist with the program and also work with psychology postdocs. And we currently see Pride patients at 6 different sites. And this includes a collaboration with our LGBT Community Center of Greater Cleveland. And the picture on this slide is a picture I just took a few days ago when I was there at the LGBT Center doing patient care. So it's a really beautiful space and a really nice way that we can be embedded in the community. So learning opportunities that exist both for medical students and residents. So we offer a preclinical and a clinical LGBTQ health elective for medical students. So right now, for example, I'm teaching like a case-based longitudinal curriculum for the within Case Western Reserve for their medical students, which is really great. And then if you're a resident, you have the opportunity to do continuity clinic sessions at a Pride site so that you can get exposed to hormone therapy for transgender patients, PrEP and PEP, and just sort of bread and butter primary care with a focus on LGBTQ patients. So That's really the formal part of our presentation, and we'd love your questions. But Dr. Alexander or Kate, do either of you have anything to add?
So I would say that this is truly one of the highlights of the program. We have tons of medical students that rotate with us. We at first were kind of hesitant to have medical students involved just because of the transient nature of medical students having a rotation and then they would be gone, and we didn't really want the patients to feel uncomfortable or the patients to feel like they were being experimented on or gawked at or any of those sorts of things. So we were really really limited in our opportunities for medical students. And when we did have medical students, it was such an enriching experience, both for the patients as well as for the students. And if any of you were in the presentation on the homeless on Monday, so many patients, they just want to be listened to. And as a medical student, you're not on the clock. You're not on that, 15 minutes has gone by, your next patient is waiting, and now your next patient is checked in. And, you don't feel that sense of hamster wheel that so many faculty feel. And so you have that opportunity to spend time with the patient and to really get to know them and to really listen to them. And so as we started taking medical students, we really found it to be such a great experience for both the patients and the students that it then really caught on. It became very, very popular, and we realized that we needed to really swing those doors open and that there could be so much enriched learning that could happen as part of this. This clinic has grown so much that Dr. Myers and I were just speaking earlier today about, people come from hours away to be seen by our pride doctors and in our system. We've had people from Michigan, from Pennsylvania, from West Virginia, from Southern Ohio, and with the advent of telehealth, I think that's going to be helpful. But they really want to be seen, and it's all walks of life. I mean, one person that we just saw recently who had pretty severe developmental delay, got later diagnosed with bipolar disorder, was actually at the end of the day realized was transgendered male, developed heart disease. There was this whole thread of taking care of this person throughout his lifetime. And I think if we didn't have the Pride Clinic, that person just could so easily fall through the cracks. So it's been a wonderful experience to watch this grow and develop. It was just kind of starting not long after I came to Metrohealth, and just has been wonderful. So, and Kate, I don't know if you have some things that you want to offer from your time as a student.
Yeah. So I went to medical school in the area, went to Northeast Ohio Medical University, which is the Akron area, for those of you familiar with Ohio. And I was fortunate enough to rotate at Metro as a 3rd and 4th year student. And Metro offers a urban health elective, which is one of the avenues for students to get involved in the community work that Metro does, including the Pride Clinic. And I think one of the things that struck me as a student, and now I think about as a resident, is what type of culture Metro has in terms of LGBTQ health. And I find that so many hospitals have their own culture, and when you're looking at residency programs and you're looking at different places to go as a student, you have to think, where do I fit? Where do my values fit? And I think at Metro, they wear their values on their sleeve, and that includes equality and healthcare for LGBTQ community. And for me, that was very important. I have an interest in the underserved. I have an interest in people who have kind of been disregarded by the healthcare system. And Metro really values that. And you can tell that through the questions that we ask that are built into our medical record. And this might seem kind of, in the weeds, but Metro has screening for what do you like to be called? What is your preferred pronouns? How do you identify? And patients appreciate that. And so in family medicine clinic, you know, I try to, when I have new patients as a resident and run through that, even if patients, you know, identify as straight, I mean, they really tend to appreciate Metro's outlook on the sensitivity and awareness of different, you know, healthcare issues that might confront the LGBTQ community. And I think that's the through line throughout all of Metro. That's not just family medicine. I rotated in surgery, I rotated in OB-GYN, I rotated all over the place at Metro. And I feel like that is a thread that exists throughout the hospital system. And so when you start thinking about where you want to train, think about what values are important to you, and does that hospital system represent that? And I think that this is just one of the windows as to how Metro kind of walks the walk and talks the talk. It's very easy to say, oh, we're gonna, you know, support LGBTQ health, but very few hospital systems actually have the integrated and comprehensive curriculum that Metro does for patients and for resident training.
I'm glad that you brought that up, Kate, because I do feel like, you know, when I've been at Metro a long time, and I feel like when I first came, because we never turned anyone away, and we, you know, we're the safety net hospital, so we take care of everyone regardless of their ability to pay. And we had a few satellites in the community, and we were kind of congratulating ourselves and patting ourselves on the back and saying, you know, we are all about community, and these are our values. And then we did a deeper dive within the department to say, well, really, how are we acting on those values? You know, is it really enough to just say, here we are, we don't turn anybody away? Is it really enough to have a couple of satellites in poor neighborhoods? Is that really getting care to the people when and where and how? And so Pride Clinic was one of those very first opportunities for us to interface with the community, to do the focus groups, to do the hard work of saying, how are you getting your care? Why do you choose to come here versus other places? What do you want for your care? What does ideal look like? And then really to build services around that. And that has been an approach that we have now used in lots of different ways, but really the Pride Clinic was us, you know, at the very first putting our toes in the water. And really was one of the first places where we integrated the psychologists and psychological services, because as you might imagine, you know, maybe not as much for folks who are not transgendered, but for folks who are transgendered, that is a huge emotional load to manage. And the patients that I have known that have been transgendered have always had this sense throughout their life, like they know it. I was explaining this to my 16-year-old when he was saying, I don't really understand transgendered. Like, what does that feel like? What is that like? Why do people struggle? Like, what is that about? And having that discussion of, okay, well, you're a boy, and you have boy parts, but what if you felt like a girl? And you wanted to be talking about other girl things, and you wanted to have periods, and you wanted to have live like authentically you know? And I'm so grateful that we have people that can walk our patients through that process and be available in all ways that touches every aspect of their life. So I think
Dr. Chen is here as well.
Oh, excellent.
Not
Yes, I
put you
did
on the
join. Sorry,
spot.
I'm a little late.
That's
It's okay.
How are you?
I'm good. How are you doing? How's everyone doing?
Good. There you are. I can see you. So Dr. Chen is brand new faculty, started this week. So really, literally brand new faculty. And Dr. Chen actually went to the same medical university that Kate did, and worked with us as a student. We were able to recruit him as a resident. We were doubly lucky to recruit him as a faculty. And Betty, do you want to maybe share a little bit of your experience working in Pride Clinic and getting the training and as a resident?
Yeah, I was fortunate enough to be trained with Dr. Van Auken before he decided to retire. So during the residency, you get 2 elective months. I think there's more now with the changes to the schedule, but for one of my elective months, I decided to spend that time exclusively with Dr. Van Auken at whichever site he was at. At that time, that was McCafferty, which is, I don't know if you guys went over the old site, and the LGBT Center. So I really got a chance to see the different locations and the different settings that we provide LGBT care. And it was under the guidance of Dr. Van Auken that I learned how to manage hormones, kind of how to properly address and talk about preventative health with everyone, regardless of what their identity is and what they actually came in for. And it was with Dr. Van Auken that I kind of looked at the Pride Clinic, not so much just as providing care for kind of like transgender and the specific care for the LGBT population, but kind of just medical care for a population that may sometimes have trouble accessing healthcare in other clinics that isn't quite as tolerant, as safe as a Pride clinic would be. We actually, in one of the first few days I was with Dr. Van Auken, was seeing a transgender patient. He came in for just kind of usual hormone management, but then we got into talking a knee injury. Ended up doing a physical exam that found a lot of laxity in the knee. Ended up getting an MRI, found like multiple torn ligament that he was not going to get care for because he just wasn't comfortable going to other clinics. Ended up getting him connected to ortho. So with our Pride clinic, we are kind of pretty all around care and not just kind of specific to what their LGBT needs are, which is great.
I just want to remind the students that if you have questions or thoughts or comments, there is the chat space that you can enter. I'll send a note to everybody here that you can enter your questions and comments so that we can get them and call on you and get them addressed. So I'm just leaving you all a message here so you know. So one of the really interesting things that we talk about Dr. Van Auken a lot, because he's just like a hero to us in our department. He just retired after 30 years of service, but the interesting thing about him is that he was trained as an activist, as a community activist. That was his role. And before he went to medical school, Metro has been around since, the 1800s. And so at one point in time, they were thinking about selling off the hospital. Instead of it being the city hospital, they were thinking about selling it to a private hospital and making it a private hospital, which would have completely changed the dynamic of the mission of the hospital. So Dr. Van Auken was the person who organized all the community activism around Save Metro Hospital and keeping it a safety net hospital. And because of the efforts of that group, Metrohealth then became affiliated with the county. And we say that we're the county hospital. The county doesn't technically own us. They contribute to a piece of our budget. And that's what helps us to stay committed to serving the underserved. But, so Dr. Van Auken was like just a trailblazer, and it was that experience that then prompted him to want to go to medical school, and then of course became a Metro resident and so on and so forth, and the rest is history. But yeah, so he really, his efforts were really far reaching. And I think that the Pride Clinic was probably, the icing on the cake of the cake that he built for Metrohealth. So glad, Benny, you got to work with him.
Mm-hmm.
And we're hoping that even in his retirement, he'll come back and teach and continue to inspire the next generation of folks. So Benny, you'll move on to doing Pride work. We do, I think Dr. Myers mentioned some of the locations. When we started, we literally were just at the McCafferty Center. So that was a teeny little satellite that was in the middle of the Hispanic community. And there wasn't really a whole lot of forethought of where that very first clinic went. It's not like we felt like there was a need in of Hispanic patients who were LGBTQ. It really was that Dr. Van Auken, that's where he saw his patients, and he was able to rally to train the staff that was at McCafferty, and they had an opening to have an evening clinic. And the nurse manager at that time was super supportive. And so just figured out all the staffing, got everybody trained, and opened up the Pride Clinic. And as time and interest grew, that then kind of became the hub. And as new folks got hired in that were interested in doing Pride work and had been trained to do Pride work, or maybe were trained in our program to do it, they would spend time at the hub and then kind of get spun off. And so this very natural process would happen that patients would start off in the Pride Clinic and then just follow their doc wherever their doc spent the rest of his or her time seeing patients in continuity. So our goal, when the Pride Clinic started, was to say, well, for right now, we want to have this safe space, but eventually we want every clinic to be its own safe space, so that we would have enough people trained at every single clinic, so that patients could go anywhere. And there is kind of this dividing line of what patients are interested in. For some patients, they really want to be in a defined Pride clinic, which feels safe and comfortable to them. And then there are others that say, no, I just want to get my care that's close to home or wherever, but I want people specifically trained to meet my unique needs. So it really is this interesting kind of thing that's developing. So I think we will already have a hub, which is now relocated to that Gordon Square clinic that Dr. Myers alluded to, that's embedded within the LGBTQ community center. And that again is taking the Pride Clinic to the next step, that we want to be rooted in community. We want to be where the patients are and where the patients are comfortable. So it's kind of like Pride Clinic 2.0. And I think we have a couple of
questions.
Yep. Go ahead.
The first question is, I know one of the focuses of LGBTQ care is hormonal therapy. What other services would you say the clinic focuses on? So I would say we do full spectrum primary care. And if you happen to fall under the LGBTQ umbrella, then we have an approach that is mindful to the unique social determinants of health that affect the LGBTQ community, and also the particular health disparities that affect the LGBTQ community. And so while I guess the more like niche thing we do is hormone therapy, because not all primary care docs provide hormone therapy, I would say everything else we do is everything we do for all our primary care patients. And so some additional things that I would say we do in higher volume within the Pride Clinic would be the prescription and management of HIV PrEP. So we definitely prescribe and manage a lot of folks on pre-exposure prophylaxis for HIV. And those are sort of, I think, the main sort of more specialized things that come to mind. But I think this ties into one of another question was about, is your site involved in family planning for the LGBTQ community? And if so, what does that look like? Absolutely. So we provide, full spectrum family planning options in terms of contraception, and also, helping you grow your family if that's your goal. So I certainly myself have counseled lots of queer and trans patients on contraception when it's needed. We place IUDs and Nexplanons and all the typical forms of LARC and birth control in patients regardless of their gender, including transgender men when it's appropriate. And then in terms of you know, growing your family. That is what we do as family docs and what we're happy to do as part of the Pride program. And so I guess when I'm wearing, you know, my other hat as the director of our maternal and newborn services, I would love to see us grow this portion of what we do for prenatal care within our LGBT patients. We certainly refer people for sperm cryopreservation and trans patients, egg cryopreservation, if, you know, if you're born with ovaries. And so there's that aspect of things as part of hormonal care. But then, of course, no matter how you get pregnant, we can take care of you once you are pregnant as family physicians. And I think we are particularly well poised to do that as family doctors because we already take care of people of all genders. And it alleviates the need to have to go to a gendered space, which unfortunately is what OB-GYN spaces are. And so while I've only been here a few months, I know that at my last job, I delivered the babies of, I think, 3 or 4 transgender men within our program. And that was sort of like new to the health system, but we did that as family doctors. And I definitely want to see us do that here at Metro. And then the other question was, I'm an MS4 with Midwestern University. I was wondering what financial and social resources are available to help patients navigate through the process of undergoing sex reassignment surgery. So I would say the clinical part of that is that we as the providers and along with our psychology team write the necessary letters that you need before most surgeons require letters from at least 1 or 2 physicians or mental health providers, I should say, before you can undergo gender affirming surgeries. So then I guess the financial aspect, that one is tricky. There are definitely procedures that are covered by commercial health insurances and also by Medicaid. And it just depends on the procedure, and it depends on the state, and you know, it's very local. But I would say Metro, more than anywhere I've worked, has phenomenal resources to help people navigate these things. If you're not insured, we can help you get insured. We can see you if you're uninsured. And so I don't know if I'm fully answering the question, but I would say that between our social work team and our mental health team, I think we provide pretty nice wraparound care.
And I can jump in also. So several years ago, we had Medicaid expansion, and I want to say it was like in 2010-ish that we had Medicaid expansion, and Medicaid expansion allowed far more patients to get Medicaid coverage. And that was really a game changer for so many of our patients that wanted gender affirming surgeries, because they really kind of fell in that space that they maybe made too much money to qualify for Medicaid, but maybe couldn't afford commercial insurance. And so we were able to get many patients onto Medicaid. The interesting thing, and I got to give it to the state of Ohio for kind of fighting the uphill battles many times over when there have been threats to Medicaid expansion, and we've held tight on that. So that's been great. But the other really awesome thing about Metro Health is that because we have this belief that we don't turn anyone away, regardless of their ability to pay, that allows us to set up systems where we can provide very deeply discounted care. And that's actually what the county gives us dollars to supplement. And so we have this community discount system already in place. We used to take care of far more people through community discount. And when Medicaid expansion came along, a lot of those patients moved from our community discount program onto Medicaid, which then left a larger pool of dollars available for those who needed them. And so I think that this is definitely a population that benefited from that, because it is not an inexpensive proposition to have gender affirming surgery. And so to have a larger pool of dollars to draw down from allows you to provide that service for far many more patients than even 10 years ago. So So I always feel blessed, and I have to kind of remind myself often what it felt like when I first came to Metro. I've always worked in underserved medicine, but I have to keep reminding myself what it felt like when I first came, to know that there's all of this available, you know, that there's so much wraparound services. And we have a whole institute now called the Institute for Hope, which is really all about addressing social determinants of health, and, you know, our Population Health Institute. And there's just so much more that we can offer patients that I'm always thankful for that.
And I'll just jump in to add that this is tangentially related because it's not so much surgery, but with the hormone therapies itself. Sometimes insurance may not cover all of it, may not cover a certain formulation or a dosage. Metro has a list of medication that is under a special price that does not need to go through any insurance pre-approval or anything like that. And that includes both estrogen and testosterone in multiple different forms and delivery methods. And a lot of times when patients don't have insurance, we can get them at an affordable price through our pharmacy, and they can continue their hormone therapy.
Yeah, I'm glad you brought that up, Benny, because that's called the 340B pricing, which is part of a federal program that allows us to get these medications at a very, very, very deeply discounted price. So then we just pass that discounted price on to the patients, and that makes a huge difference.
Yeah, I think,
I'll just
you
say,
know, as a student,
go ahead, Kate.
I was just going to say, as a student, I was able to rotate at a bunch of different hospitals and kind of see how barriers really put patients at disadvantage in terms of accessing healthcare because of cost. And as someone who's interested in health policy and health systems, you know, it's very refreshing to be a resident in a system where I feel like that is a priority, where what the patient has to pay in order to get the care that they need is something that is taken seriously, and steps are taken to alleviate that. And so as a resident, I never feel as an island unto myself for advocating for patients having fair costs for their health care. And if there is a will, there's a way. If you have a patient who is facing a block for hormone therapy, or, you know, gender reaffirming surgery, or whatever it may be, even if it's like Lipitor or I don't know, metoprolol, whatever, there is a person at Metro who can help you. And I think that's really refreshing. It's one less battle you have to fight as a resident. So from my perspective, it's the question about how does Metro help people, you know, pursue their true self as part of a larger system-wide effort to help patients reach their best health in an affordable way.
Yeah, I think that's such a valuable point, Kate. And I'm so excited that you feel that as a resident, you know, because like I think sometimes it's so easy to be in the tunnel of residency and, you know, just get through the day, survive, do all the things you have to do. To be able to see that and feel that is so good. And so I always tell a story, and I'm going to try not to take up too much time to tell the story, but I was at my office. I was a new chair, and my newborn at home was not well, and my husband was calling, and I was writing a grant, and I was at the office super late. And so I answered the phone thinking it was my husband, like, you know, calling to say, where are you, you know? And it was my fellowship director who had just retired. And he said, hey, I was just calling to check in on you. And I'm like, why are you calling me at 9 o'clock at night? And he's like, why are you answering your office phone at 9 o'clock at night? And I said, I'm writing this grant and it's due and blah, blah, blah. And I said, you know, like, you just retired, and your retirement speech was all about, like, thanks for making this a joyful place to come every day for 30 years. And honest to God, right now, I'm not feeling a lot of joy. And he said, well, okay, let's fast forward to when you retire. What are you going to say? What are you going to be thankful for? What is going to be the thing that gives you joy? And I was like, oh, absolutely. It is that I was in this place where I was allowed to do everything I needed to do for every patient that I wanted to do it for, and nobody was going to tell me no. They might say, we have to figure it out. We haven't figured that one out yet. We need help figuring that one out. We're going to get there. We're not there yet. but they're never going to say no. You can't help that person. That is never going to happen to me in this place. And he was like, right. And that's what you said when you decided to go there. So put on your big girl pants, get back to work, and get home to your family, you know, but just don't lose focus on that. That's what this is about. And that grant actually ended up being the underpinnings of what is now the school health program. So it really is great to be in a place where you really can do that sort of work. I think, was there one more?
Yeah, I think there's
Yeah.
and I might punt this one to Doctors Kelly and Jen, but are there community outreach opportunities that help connect residents to the LGBT community outside of the LGBT center?
So I don't know if Dr. Chen knows anything particularly, but all four, Dr. Alexander, Dr. Myers, Dr. Chen, and I are all native Ohioans. So, which is pretty cool because we all kind of scattered, but we all came back. And, you know, Cleveland is a city that sits halfway between Chicago and New York, basically. And so it was this big traffic route where a lot of innovation happened and lots of people moved. And because of its position, I do believe that it has become a growth area for arts and for culture. And for those communities that lie outside of Cleveland, it's the LGBTQ communities, I think, see Cleveland as sometimes, you know, a safe harbor to access care, as Dr. Alexander was saying earlier today. And so I think because Metro has such a historical stronghold within the Cleveland community, it was the city hospital was downtown, right now where the baseball team plays. That was its original site. Started by the cholera epidemic when all these people were going to Michigan from New York. There is such a respect for the hospital that you can connect to other groups within Cleveland that do this, you know, important type of work. And I don't know if Benny has any, or Dr. Myers, Dr. Alexander have anything more to say, but I think if there's a group that you want to work with, you know, they'll be happy to work with you. And I think we just have that reputation that will make those connections.
Mm-hmm.
One thing that comes to mind is we're actually in the process of, there have been other versions of this historically, but we're sort of recreating a Pride specific patient family advisory council. So we just started to reach out to patients the last few weeks, and that's basically an opportunity for our patients, along with a few staff members as well, to sort of, it's basically a forum for us to pose questions that we are curious about as an organization, you know, and get feedback from our patients themselves. You know, what can we be doing better as a Pride program? What can we be offering that we're not offering? What would you like to see in our like social media presence as we prepare to, you know, make an Instagram account and things like this to like advertise our program. So I think that's a really nice way to connect with the community and to have buy-in from our patients.
Yeah, I don't know if your question is trying to get at if there's anything built into the residency program in the hospital itself. Nothing's coming to mind. That being said, like Dr. Kelly was saying, Metro is so ingrained in the culture of Cleveland and so involved in the community that we've got our hands in quite a few of kind of the events throughout the year that's happening. And oftentimes they'll come up as opportunities for volunteering that you can sign up for. The Pride Beret being one of them that I remember being advertised pretty extensively on our website, and it wasn't sort of purposefully trying to get people to volunteer, but just kind of saying, hey, here's an opportunity. If this interests you, you can sign up and volunteer. And we have, I think, one of our residency coordinator, Kate, has volunteered at the Pride Parade in past years. So nothing that is kind of formal and kind of organized for people, but the opportunities are there. And just by Metro being involved in the community, there will be opportunities for you to get involved in other ways.
Yeah, I think that's I was thinking about the Pride Parade, you know, that we're involved in the Pride Parade every year. We also have a Pride Employment Day, so that, you know, we really like to recruit, you know, a workforce that's reflective of our patients that we serve. And so, but there are lots of different volunteer opportunities that come up in lots of different ways, you know, so like the mammogram van that we take that to many different places, and you know, we do breast exams where we do the free mammograms, and so there's just lots of things like that that come up. We also try to be really careful what we ask of the residents, because us asking them to do it technically can fall into the duty hours, and so we always want to be really careful that we don't overextend the residents. And even if it's a volunteer experience and it's something that we know they love and that they want to do, we want to be really careful, because we don't want to burn people out. But in general, when you go out into the community and you have these experiences, those tend to be really rejuvenating experiences for most, but we walk that fine line. But there are definitely things that come up all throughout the year, and we, you know, offer it to the residents and just kind of follow it, you know. Unless, of course, it's going to have ice cream with Benny, that never ever will come up as a duty hour violation. I'm just saying.
Never.
Yeah.
It doesn't count. It actually subtracts from the duty hour requirements.
That's right. I forgot about that rule.
And I see, okay, here's some more questions. Do you offer any seminars or lectures on handling cultural disability preferences in the hospital setting? Also, any training on how to communicate with LGBTQ patients regarding healthcare? Great question. We do. I myself and my wife, who's also a family physician in our department, are giving a didactic lecture series. So it's sort of a longitudinal lecture series on LGBT health, and you know, we cover things from communication and health disparities to just LGBT primary care considerations, and then there's a whole hour dedicated to hormone therapy and care of the transmasculine patient, hormone care and care of the transfeminine patient. And then I think there's at least one more that's not coming to mind. But anyway, these are part of the resident didactics that happen every Wednesday afternoon. And so the idea is that, you know, during your 3 years of residency, you'll catch all of these lectures at least one time. And then the next question is, thank you for answering my questions. It is so wonderful to hear how much patient advocacy Metrohealth values and how, okay, not a question, a lovely comment. Thank you for the lovely comment.
The lectures that Dr. Myers gave, she gave the first one, and it's very good. So also, it was so good. And she taught me how to prescribe PrEP. But I think the other part is Dr. Myers is at our Ohio City clinic and her wife is at our Broadway clinic. And we just have such great faculty at Metro that all the time in the clinic is a learning opportunity. So we have formal didactics, which are great, but then every day I go to clinic and I'm seeing patients, I feel like I'm learning something. I mean, family medicine is a tough field. You guys all know that. There's like so much to know, and especially as an intern, it can be like overwhelming, like, oh, I don't know anything. I just thought the answer was beta blocker, but sometimes it's not. But the glory of having a really kind of the breadth and depth of our faculty is that all of the faculty kind of share the mission of Metro, and so they all can teach what they know about the topic. And they are humble enough to say, you know, I'm not quite sure, why don't you ask Dr. Myers or Dr. Alexander or Dr. Chen or whoever it might be. And so I think formal didactics is wonderful, but also this informal didactics I think is invaluable. And that's something that as you kind of go out and look at residency programs, whether or not you choose Metro, which you all should, but you know, that you should consider, because sometimes you don't have that. And I think that is equally as valuable as the formal didactics. I don't know if Benny has any thoughts about that as a now graduated resident attending.
Yeah, I absolutely agree with what Dr. Kelly said. I think didactics is important. I think there's a lot of good learning that can happen during didactic, but the the precepting and the clinic and the day-to-day work, even inpatient work, a lot of learning, little nuggets can be taken from every interaction with patients. I think one of my favorite opportunities is rounding with Dr. Alexander on the floor and seeing her like bedside manner is one of the gems of this program.
I owe you some ice cream.
Thank you.
But I think to that point, you know, I think we all continually learn from each other. You know, like I never in my life really prescribed testosterone because so much of my practice was maternal child health. And I was, you know, more dealing with like dysfunctional uterine bleeding and all of those sorts of issues that I was so heavily like OB and peds focused that I really, you know, didn't know much about giving testosterone. And so I actually learned a lot from the residents when we had a patient together in the hospital, Benny, and you were like, okay, let me give it to you. This prep for this prep for this prep for this. Let's try this. So let's do that, you know, and we all learn from each other. And I think that's also the thing that I value so much is that it really is such a team atmosphere. And that we're all open to learning. Like I would love to deliver a transgender male patient. Like I've not done that in my career. I want to do that. Like I want to learn that and I want to do it. And that, you know, like we support each other, you know, that's just who we are. And it really makes it a great place to work. But to kind of, to Kate's point, the residents do precept every single case and in the outpatient setting. And I know some programs don't do that, but we do, and we've done that, golly, for the 23 years I've been here, we've pretty much done that the whole time because we see every patient as an opportunity to learn something. Even if you're a third year, you know, discussing heart failure, you know, heart failure is different from patient to patient to patient. Beta blockers often are the answer, but not always. And right, so you kind of learn that. And the nature of the precepting obviously changes between being an intern and being a third year, that what you're gonna focus on, and you're gonna hear more of the story, you know, from a first year than what you're gonna hear from a third year. And maybe you and the third year together are gonna be looking up protocols and figuring out, hey, there isn't a guideline on this. Maybe we should try and publish a clinical guideline on this topic. And, you know, so it really does change from first year to third year, but we really like every patient's an opportunity to learn. So just kind of wanted to put that out there.
And back to circle back and give an example of, because you can kind of learn about how to speak with transgender patients and like practice using pronouns and like learning what the appropriate pronoun is, and then actually using it in the room with the patient and precepting with the attending, you will still stumble on it. And it really is that practice and knowing what to do when you stumble on pronouns in front of a patient. I think that's a valuable lesson that you don't really get from didactics. And I think taking the lessons from didactics and putting them into practice in clinic when you're working with your preceptors has been very valuable to me working with, and I got a chance to work, I know I said I work with Dr. Van Alken, but I also got a chance to work with other PrEP providers and seeing kind of their own style and what they do and what their preferences has been really helpful.
Mm-hmm.
And
another thing that,
oh, go ahead.
Sorry, I was going to say another thing that really facilitates, I think, respect for patients and also just communication with patients is that our electronic medical record, which is EPIC, allows for a preferred name field, pronoun fields, an anatomic inventory. So you can actually say, you know, here are the body parts this person has and does not have, which then informs what types of health maintenance they need. And I think more and more health systems are incorporating these features into their EMR, but it's a question to ask because it really does positively or negatively impact patient care when from the first time they call in or when they're checking in or when they're called from triage that they are respectfully addressed by their chosen name and by their pronouns. And so I'm really glad that we have those things in place.
Mm-hmm.
Yeah, I was just gonna, perfect dovetail to what I was gonna say, patients obviously are our greatest teachers all the time. And I think that having that built-in system, kind of destigmatizes the questions as well. And, at least I open it always up with, these are questions that we ask all of our patients. And then I think it helps patients be a little bit at ease, oh, this is just something that Metro does, which they like, and, I had a patient recently that said, was going through the, how do you like to be identified, the inventory, and she said she likes to use female pronouns, but she considers herself a male. And, I was able to make those adjustments in the EMR to make her more comfortable with the visit. And I think the nuances of the kind of gender spectrum are so open within our clinic and how we address things and how we've kind of altered and adjusted our medical record to make sure that each patient is treated as an individual. I know that sounds so cheesy, but I think that that's important, just an important thought to have as a clinical practice and as a hospital, that we have these boxes, but we're also open to however patients feel most comfortable. I had a professor in medical school that said the patient is why we are here. And I constantly think about that. And, we learn from each other, but we also learn from our patients every day.
Well, and I think, once we started really down this path of asking about pronouns and how do you prefer to be called and all of those sorts of things, that just benefits all patients across the board, right? Because every single patient wants to be an individual. Every single patient wants to have that individualized care. And I think our Pride Clinic has just made such a huge impact on the care of everyone, because it wasn't really until we had that well established and we realized the importance of asking people, what are your pronouns? What do you identify as? Like all of that. But it makes it so much more comfortable for everybody because we ask everybody those questions, and then you really get to know your patients on a whole different level. That's huge, right? So I was just getting the kind of countdown from Larry Bauer that we have just a few minutes remaining. Were there any other questions that we didn't get to, or any other closing comments that anybody from the team wanted to make?
Hi, I have a question. I don't know if can you hear me?
Yeah, we can.
Oh, okay. So I'm a student in Philadelphia, and there's a Pride clinic at one of the hospitals that I'm working in, and it doesn't seem as present on campus at the hospital. But I would like to get involved. What are, as Metrohealth, you guys have done such a great job, it seems, at walking the talk and all, but what are some barriers that you guys had, or an advice that you would have for people who are trying to make their program more present and sustainable for the LGBT community and whatnot?
Want me to take this one? So I would say, for us, the barrier when we first wanted to start the Pride Clinic, we had to create a business plan for it, because ultimately you have to sell these ideas to the administrators, right? Because you got the support and the staffing and all of that. So you really have to sell it to the administrators. So we did a lot of work around what's the interest in the community, what's the need, doing focus groups, with the patients. And Doug Van Auken was just really well connected in that community. So he was able to rally a lot of people. I think him being a community organizer also helped, that he could rally people and get focus groups and get a lot of really good information and generating data. This is especially a data-driven world now. So generating data on what's important to patients, what they want, what are their needs. But then as you create the business plan, for us, so many of our patients were, our LGBTQ patients have commercial insurance by and large. Some don't, but when we started the clinic, the vast majority of those patients had commercial insurance. When you're the safety net hospital and you have 70% or more of patients coming to a clinic that have commercial insurance, that's a winning business plan all day. So that really helped us to then develop the business plan to say, okay, we want to launch this, and here are the downstream effects of that, right? Because when you're doing these sorts of labs or these sorts of meds, you're going to follow labs more. You know, there's the gender affirming surgeries. There's all that downstream that an administrator, those are numbers that they look for. They don't understand the whole human aspect of it. They don't understand it from taking care of a vulnerable population, but they understand numbers. So using that to get the buy-in from the administrators, and then coming back and saying, okay, now here are really the needs. If you want to continue to have this flourish and you want to grow, here are the needs that we need to continue to address, right? And so that's kind of, I think that would be the long view. I'd be happy to have a kind of like side conversation or help connect you to folks. I also trained in Philly. Dr. Myers just came from Philly.
Oh.
So we have
Okay.
there that, you know, we could kind of connect and chat a little more.
Okay.
Okay.
Yeah, Manny, I just sent you my email address in the chat if you have questions about
Oh,
getting
okay.
involved in Philly.
Okay. Awesome. All right. Thanks.
Yeah,
No
that's
problem.
awesome. Any other closing questions from the students before we wrap up for the night?
I'll just say as a closing comment that you know, my wife and I relocated to the Cleveland area to be closer to family, but there's no shortage of health systems to work for in the Cleveland area. And we very intentionally chose Metrohealth in large part because of the established PRIDE program here and the opportunity to continue the care we had been doing for you know, sexual and gender minority patients. And I have been so happy, and the people here are wonderful and just pleasantly surprised in so many ways. And so definitely check us out if you're thinking about this area for residency.
Yeah, I appreciate that. I'm especially excited to have been able to recruit Dr. Myers and Dr. Phoebe and Dr. Chen. Really excited to have stellar residents like Kate Kelly and her co-interns and co-residents. I feel particularly grateful and blessed. I've been here 23 years and I can't imagine being anywhere else. So appreciate you all joining us tonight. I don't know if Kate or Benny have other comments, but the meeting does launch tomorrow, and we have the residency fair. So please feel free to stop by our booth at the residency fair as well.
I'll be there from 6 to 8, so come on by.
I'm going to add one comment. We have a role model fourth-year student from Midwestern University. And the reason she's a role model is she not only has her name, she has her, she's identified the year she is in medical school, and she's listed her medical school name. That makes it so much easier when you walk into a booth, virtually saunter into a booth. Take a moment and update your description of who you are. You'll find that it just makes it so much easier for the people to receive you. And I want to thank Dr. Alexander, Dr. Kelly, Dr. Myers, and Benny for being a part of this presentation this evening. Metro is, not only is Dr. Alexander Rager our current immediate past president, soon within days to step down from the board. We've been buddies since she was in Philadelphia many, many years ago. But what you've created over the years, it's just truly impressive to see what happens when you have effective leadership. So my hat's off to you. And we're going to bring things to closure at this point and say thank you, everyone, for participating this evening.
Thanks so much, everybody.
Thank you.
Thank you.
Good meeting.
Everyone, thank you.